Hello to everyone, and welcome to our toolkit discussion today. IN-4-AHA, Innovation and Active Innovation for Active and Healthy Aging Networks project is about to provide tools to innovators to be more efficient and to be more secure and to scale up with their solutions, not only in the regions where they're working, but also cross-border. And today's workshop is next step in our path to develop a toolkit for companies who are actually providing solutions for the actively aging part of the world. And in today's program, we have two presentations. And then after the presentations, I will give you a short overview about the work that has been done so far. And then the last part, we will have a very short discussion with the presenters, today's presenters, to discuss few pain points or obstacles they have experienced in their way of developing solutions for active people in the world. I just don't want to say this aging world. But first presenter is Andres Mellik, and he is representing SpeakTech's solution developed here in Estonia. And yes, Andres, the floor stage, the camera is yours.
Okay, so thank you for the opportunity. So I will basically do a quick introduction of SpeakTech itself, which has been on the Estonian market already since 2014. And initially it actually started with primarily the elderly population. So we developed a post-stroke speech therapy platform for patients suffering from aphasia. And these are generally 60 plus age group. And the platform itself, what it basically provides is a suite of interactive exercises developed already from the start together with speech therapists, the leading ones here in Estonia. And it has evolved into quite a comprehensive platform by now. So providing around 1,000 exercises for various speech impediments. And they're based on 20 templates. So speech therapists can actually create sort of purposeful and focused exercises in terms of content and function that they would like to have. And what the platform then provides is an opportunity to provide personalized speech therapy plans accessible anytime, anywhere. So it supports the remote type of therapy that has gained a lot of acceptance during the pandemic. We are also adding a video consultation, so a one-to-one video consultation and therapy session opportunity or features within the browser. And then there's a temporal overview of the results that the patients or the users are going through. And so the main benefits of the platform obviously are quick access and independent of the location of the patient or the user. It's very cost efficient, so you don't have to travel anywhere to get to the same type of routine treatment or therapy that you would otherwise be having to go to the therapist's office. One of the most important benefits is that, which solves the problem of the therapies that are not being consistent and systematic. So on our platform, that's very easily achievable. And it's time efficient, so you can choose the time often when and where you want to do it. And in terms of traction in Estonia, about half the hospitals, but also about half the kindergartens and schools are actively using the platform because it's basically age independent. And children actually have the most speech problems and impediments, but so do the elderly. And I would like to focus on two use cases that basically have that we have went through in the last 18 to 24 months. So first one is again it's focusing on the pediatric population, but This might as well be, something to do with aphasia or other speech problems that the elderly have, where we run a pilot with 20 kindergartens in Tallinn, which is the capital of Estonia. And 10 of those institutions have a speech therapist and 10 don't. And all of those institutions have access to the SpeakTX platform. And the way we worked, so the goal of the pilot study was to figure out whether this is applicable for a wider audience, for a wider array of institutions, how well it is received, what are the results temporally, and how well could we, or how efficiently could we empower non-specialists to provide the same type of support. And I don't want to say treatment, because in the kindergarten and school space, it's more of an educational technology solution, so they're not necessarily patients, though many of the speech impediments are carried by ICD-10 codes as well. And in the pilot, so relevant to this discussion is, of course, the fact that we included 200 children together with their parents, which is a large number for any study in Estonia, and we also included 100 specialists. So that includes both speech therapists, occupational therapists, and kindergarten teachers. And the way we ran it, the pilot was about 8 months and in 3 different phases. So we basically provided them with the environment for free. We provided them with the sort of empowering materials so that they would be able to use it independently. So the support load coming from the users was relatively low for the 8 months. And we measured the feedback coming from the users with very, very comprehensive surveys. So separate surveys for the specialists, separate surveys for the family members. So in that sense, it was a co-creation from the beginning, and we improved on some of the feedback that we were receiving temporarily. So after each phase, each phase was about 3 or 4 months, and so we took that feedback into account. And for the end users, meaning the children and their family members, the goal was completion of speech and language exercises assigned by a specialist and completing the surveys. So that was their involvement in the co-creation. They also had to find the time, obviously, to participate. So there was a little drop-off during the usage or utilization of the platform, and that was also reflected in the exit surveys. So obviously the number of participants decreased a little bit after each phase, because simply didn't have the time or the commitment to participate. But the ones who finished were 92 to 100% satisfied with the platform. And for the specialists, their commitment included then assigning those specific exercises for children or 2 children that had difficulties with speech, and also completing some of those exercises together with the children. So in case the children were or students were at the kindergartens, then they were able to work sort of one-to-one as well. And for the specialists as well, the level of commitment that we needed from them was to complete the surveys. And I will not go into the details of the surveys, but on the right here, where the scales are as well, you are able to see much of the feedback that they provided during it. And of course, for us as a company, this is the most valuable input that we can have. So feedback from 200 end users, 100 specialists. Altogether, of course, there are more than 5,000 home users, for instance, on the platform, and many more specialists, but this was a focused and kind of isolated way of doing that data collection. And if after the event anybody wants to have access to that, we are actually publishing the study as well, and it's a big deal, at least in the Estonian context. And the second module kind of that I would like to focus on today, which even better, I think, carries the co-creation sort of idea, was that last spring, just when the pandemic had also started, we developed a separate module within the platform for managing stuttering. And officially it's called the Fluent Speech module. And I think in terms of involving the target user groups in the process of design, usability and so forth, this is almost like a prime example. So even before starting, we took a good time to actually understand the problem of stuttering. We approached immediately the Estonian Stutterers Association, or Association of Stuttering, and involved their management and their most active participants in the process, and they agreed. As well, the sort of the most prominent speech therapist focusing on stuttering, who worked with us from the beginning and throughout the project, was involved as well. So the takeaway from this is that understand the problem space, but involve not just the end users and the sort of specialists that work with the end users or the target group, but what we also did is we actually used real audio from stutterers instead of sort of maybe simulated or acted upon audio. So if we are actually able to use that module for free because it was funded from a public source here in Estonia, and you are able to actually hear and experience exactly how a stutterer would talk or would have to talk to manage their speech or make it more fluent and to avoid stuttering. So and it's accessible through the Estonian site, but I would sort of invite everybody to try it out, because really, as you can see from the screen, it is a complex problem, and the exercise itself eventually looked like a almost like a dashboard. So it's much more complex than the regular exercises that we have, and this is the effect of creating it together with a target group from day one. And also it's been getting really good feedback from speech therapists that run into people or children or adults with stuttering. And so because up until now, all they had to do always is sort of use these manual tools, the metronome, for instance, and so forth, to manage it, the stopwatch and whatnot. So in this case, we actually brought everything together onto the same screen, so to speak. And really, this is a worldwide problem. Normally, around 1% of the population suffers from stuttering. So co-creating for something like this was really a good experience for us and worked very well. And we are now essentially contemplating doing the same type of development for dyslexia in the coming months. And I guess to kind of bring it all together, so whenever we develop something, we don't really sort of devolve into the the theoretics or the sort of philosophy of everything, but in our case, the whole process really looks as simple as you can see here on the screen. So the initial idea obviously is what, why, for whom, or to whom, and how. And this is true for both the use cases that I talked about. Then engagement of the end users, trying to understand the problem more deeply. So what are the specific needs around this, so that we don't have to reinvent the wheel or sort of speculate too much. What solutions are they using now? So the stuttering example is a good one, where they were using sort of manual things, and we digitized the whole process. And what are their end expectations? So if we talk about the stuttering, would they like to be able to use this whenever they are, wherever they are, maybe before some type of a, for instance, presentation, as we have here now, and so forth. And then finalized idea development obviously falls mostly on a company like us, making sure sort of technically, conceptually, everything fits together. But then the feedback loop, basically, I guess there should be a sort of a endless feedback loop between the last two or last three of these columns, where we do surveys, interviews, ratings, user experience analysis, feasibility studies, and everything with one goal in mind, to improve the product. And really, it is as simple, I think, to do it. I think also in terms of our product, it's good that the problems, the diagnoses, and so on can be compartmentalized to a certain extent, so that they can also be addressed or attacked properly. Yes, so, and this is one of our slogans. And I think it fits well into today's context as well. So we always need to educate not just ourselves, but also our target user groups, or the institutions and individuals we work with. We empower them constantly with very methodological materials. As it also pertains to our long-term history with e-learning solutions, and the whole process then basically lets us evolve together for better and better support for those target users. But I will stop here then. Thank you.
Thank you, Andres. Really valuable input to our work, what we are doing. But I have a question. When you're thinking back, when you really started this process, what was the biggest mistake that you would definitely tell to others that to avoid?
Well, if we only focus on the sort of speech therapy applications, then one of the missing links still today, and this is especially true for smaller languages, are the difficulties that we're having with the speech recognition or speech language and synthesis technology. So this would add a lot. So we had high hopes for that in the beginning, and we put a lot of effort into that as well. We basically overcame that with other functions and other features that can help the target group. So, and which are not secondary in hindsight, but we've implemented them. They're working well, and our only hope is that in this domain, at least, or this context, we're able to at some point have some of the analysis of the speech and so forth automized as well.
Thank you, Andres, for this presentation. I hope you can stay a bit longer.
Yes.
And now we have second presenter, Rait Rand from TempID. But if you can sit here, to the audience, you can actually ask also questions and drop your question in this chat box. And later on, we will read these questions. And also, if you have some comments how to build toolbox, or then also all your comments are very welcomed. But Rait, the camera is yours now, and your experience in involving end users, stakeholders in your work.
All right, yes, my name is Rait, and I'm representing TempID. TempID is a smart patch, just 3 slides about to introduce my product. And TempID is a smart patch that continuously collects the body temperature, and you can model the body temperature to different diseases or conditions. And since the body temperature is life important parameter, the product is rated as class 2A medical device. And it means that it must pass full medical trials and so on, so on. It's very time demanding and of course money demanding. And the product himself looks like this. You put it on your body core and it starts to continuously collecting your body temperature. It lasts about a year. It's reusable. And like I said, you can share your data with a doctor or other medical stuff. Okay. Yeah, here is a little introduction about the solution himself, just some technical words and what it is as a package, how to use it. You can read it through. I will not pass all the steps how to use this. I believe all the watchers will get the slides also.
Yeah.
Yes, so that's good. So basically, it's very simple to use. You put it on your body and you use your mobile phone to collect the data. Now, what comes to the end user testing and all this experience, it's been quite hard, I would say. It's, of course, the product design started with the friends, family, and fools. We are the fools who started to develop this, of course. And like this, we basically created I could call this as the first end user experience when you spread it free of charge to your family and friends and so on, and get the response from them. But what we experienced is that this information we receive from those groups, it's not good information, I would say, because those people are usually happy that you develop something, and they don't give honest opinion about the product himself, especially if this is a medical product and so on. But currently, the real medical or the real user experience trials ongoing. I just took our map. We can see online our products where those are used and so on. Right now we're running in Kenya, in Africa, 1,000 pieces currently in use, not all of them, but quite much information already receiving from there. In Estonia, we have official medical trial. That's a real clinical trial ongoing. As the first thing, we did it with 6 patients, and now it goes to the 100 patients. And during this program, we will also do this for different age groups in Finland and Spain. So some keywords. What we asked from us when we started all the trials and the end user data collection. First, what is the purpose of end user trial? Do we want to finalize the design, test service product in real life conditions, prepare medical device certification process, or get the price understanding? Of course, all those questions are quite relevant to finalize your product. And how to get the real price understanding, that's also my suggestion is not to spread your products free of charge a very long time, because you don't get the correct information if you do it like this. So now depends on the product. There could be very hard to get end users to participate. If you need some special health condition from the persons you're using as end users, it's in our case, we need also sick people to be involved in the end user trials. So you cannot get those people from street, more or less. Maybe you're lucky, but it's not valid data you can gather from them. So many cases there must be compensation also to end users or medical personnel for testing your product or organizing product service usage among users. That was also quite a surprise for us, that we have to compensate actually the time, or yes, we're giving the free products, but we also have to compensate that they are ready to share with us all the experience. So that was also quite a news for us. What else? Yeah, it's in industry, it's called the design of experiment that you have to do before end user trials. So my suggestion is to visualize entire end user trial process to avoid not covered areas or not do possible mistakes or sources. You can use whatever flow chart, but you have to visualize the entire process. What are the decisions you need from the trial? What data will be collected through the trial? How data will be used? Should collected data be officially verified? That's also a very important thing, because if you don't verify how you're collecting the data, maybe it's not usable later on if you start doing all the documentation. So that's also, I would say, out of those 4 questions you should ask from yourself, it's the most important. free of charge service or product feedback is not correct. That's always, people are happy if you're giving something to them free of charge. They don't give you the honest opinion if it stops working, or they're still kind of happy. Yeah, and be ready to get feedback due to design faults, the bad feedback, I would say. So, of course, we were also quite disappointed when people saying that it's a crap product, but not all of them, but some of them. And of course, we made the modifications according to the information, and now we can say that it's much better, and yeah, it's a better product now due to the end user trials. And what else? Most medical products or services must get medical product verification. That's also important, even if you're thinking that it's the thing you are building or the service you're building is kind of a health product or service. Even then, it might end as the medical product. So it's it must be investigated before you start any kind of trials. Maybe it's useful to start documentation at the very beginning of collecting the end user feedback. What else? Of course, we have engineering power in our team, so we can cover that kind of special needs if the end user trials need some special, I don't know, questionnaires or something to build into the system. So we can do this, but anyone should be also ready to get that kind of resource if it's needed. If you need to do some special things for the end user group to collect the data. So, and mostly it's engineering resource that's needed there. I believe that's it from my side.
Thank you. I have also a very concrete question here in chat. Do you have experience in getting the evidence data officially verified or not yet?
Ask again.
Do
you
have experience in getting the evidence data officially verified?
Aha. Not yet, I would say, and we don't know whether we need this in our case. That's also the case, that we must start walking on the path to get everything documented. But right now we cannot see all those. Maybe it will be a topic for us, but right now I can say no.
Okay. Please define the bigger scale end users.
Bigger scale end users is, it depends, of course. You must know our product is medical device class 2A, and there is quite exact rules how big number of users must be involved in clinical trials. And the big scale, I meant that it must be at the first end user trial must be bigger than the final official clinical trials. So to get really understanding whether your product is good enough to go to the clinical trials, because clinical trial is times and times more expensive than just a regular end user feedback survey or whatever. So I would say it depends on your product, but it must be sometimes higher number than official clinical trial needs from your product. So
okay. Thank you. So thank you, right? I also hope that you can stay for a bit longer, because now I will present the work that we have done so far in our project. There was a workshop organized a few weeks ago with different stakeholders and project partners, and we came up with a list of topics, I would say, or considerations that should be included to the toolbox. And now we need to start kind of prioritizing or taking the scope narrower. But the thing is that with your presentations, you and Andres, I can see that we have few topics that are not included there yet. So I don't know how to go smaller with the scope.
Yes, I stay here.
Yeah, no okay, thank you. And I will continue with the right, left.
Okay, I'm here.
Everything is cool. So an overview about the work. What we had the workshop approximately 2 weeks ago, and now the outcomes. And actually, the outcome is the list of questions that were presented by our team who was participating in this workshop. So a participatory design to whom to involve and who are the stakeholders. These were like the quite relevant questions or biggest questions of the workshop as well. And the conclusion was that for the stakeholders, we need to include all the stakeholders, but this tool is mainly targeted to startups and industry representatives, but in a way that all the other stakeholders also can use this toolbox as for instance, to evaluate the condition of the solution, or when they want to buy the solution, then they know how this the solution was developed. Is it a valid product? Or for investor, for instance, to be more secure that the solution actually will be used in the future as well, because they have included or they have followed the steps of the co-creation process. So the main target group for the toolbox will be startups and the industry representatives. And also in some of the, or one of the reports that we are about to publish during this project, there was also designed by our expert Helen Koch. There was designed a process of participatory design and or kind of decision tree. What are the questions to ask from yourself, and then how to follow with the next steps. The questions were that, do you know clearly what your team is working towards? If no, then you need to set the goals. Do you know the biggest problem you face? If you don't know, then you need to come to the understanding what is the problem. Are you able to articulate your problem clearly? If no, then you have to frame your problem, come up with the sentences, very clear ones. Do you have range of ideas on how to solve it? If not, then brainstorming. Have you assessed whether your ideas are robust? Then if not, then evaluate your ideas. Have you decided which ideas to test? If no, then make a decision. And I'm not going to present the whole table of different methodologies or different workshops that you can use to decide or to answer to these questions, but the list of the relevant workshop types or tools how to come up with a decision or how to decide is in our report, and we will publish it also, I guess, in some format also in this toolbox. Then the toolkit should acknowledge scope of the solution. Is it only for the regional use, or is it cross-regional? Are we planning to go cross-border? I guess that this is quite important when language is important in your solution, or if we're talking about how to use data in your solution, again, going only locally live or going cross-border, it has a different approach. Then we defined some user-centered design process methods like persons, personas, patient journey mapping, experience-based service, co-design workshop, selection criteria for the workshop, what could be the criteria for the workshop. So, but already from the previous presentations, I saw other methodologies or methods as well, how to design the process. also the toolkit should acknowledge levels of the process, its development process of the innovative solution, and using the innovative solution targeted at end users to provide feedback of the solution. It was also mentioned that maintaining sustainability of the solution is important, but why it's gray in here is that maybe this is one of the aspects we can actually also touch this subject in our scale-up model, and we do not necessarily need to have it in our toolkit, just to have it in a more simple format. Other questions. The motivation for different stakeholders to use the participatory design toolkit are from different aspects, such as, and it also came out from the very clearly, for instance, from Wright's presentation, that the motivation is really important for the stakeholders. But because the toolkit is targeted mostly for the industry, then I guess that the motivation factors of SMEs are the most relevant to be mapped here, or to be embedded to this toolkit. Some considerations. How you can actually define the list of your stakeholders who should be involved in your work. So, and how to do it in a more efficient way, and at what stage to involve stakeholders, and how to define the right moment for each stakeholder to reach the highest efficiency of the process. So I guess that these are the practical questions we need to discuss among our experts. And what are the stakeholders' roles and activities or effort they should put into this process? Also, really relevant question when we talk about the resources of the development of the solutions. And how to secure the involvement of the stakeholders. Again, motivation question. Can the toolkit provide the same content for all groups, but add guidance according to the user profile? I guess this was also discussed in our previous workshop, that and the question was, yes, we should have motivation reflected for all the stakeholders, but the guidance should be added according to the user profile. What is the buy-in factor of the stakeholders to use the service and also to be part of the process? As Wright really clearly explained, it can be a question. And if we talk about municipalities, who are the service buyers, are they included as full project partners, or should they be included in some parts of the development only? How is planned the end user feedback loop for the solution? This came out from the Andres presentation, that the feedback is really relevant part of the development, and you need to think through how the process goes, and how the loop of the feedback should look like. Actually, I guess that this is also really important question. What are the communication tools that are used in communication with the stakeholders? I would imagine that text, video, or oral speech has different acceptance if we look from the stakeholders' perspective, for instance. I assume that text would be has the lowest barrier actually for the communication, for instance. I don't know, but I guess that this is one of the points of consideration as well. To continue with the stakeholders involvement, what are the ethical considerations in recruiting stakeholders? Is there an ethical committee what's the word in English? Permission required, or can we go without it? What are the obstacles in recruitment of stakeholders? Few of the obstacles came out in previous presentations, but I guess that this is one of the questions we should consider in our toolbox as well. And measures for the risk mitigation, again, I guess that there can be surprises along the way. And how the technical support, user support for all user groups is organized, is it organized at all? So again, an important question to consider in the toolbox. I also came like in my head, draw on the paper some other considerations, in TempID presentation, I could see that there are actually quite relevant questions. These are the international and national clinical guidelines, if and when they are needed to be part of this process. Other strategies in respective countries, medical device regulation, of course, and other important rules. Project organization and management, how the work is organized within the company. Do we have enough resources for run the process? Legal issues, and also I guess that it's also important to mention here, and it was part of in TempID's experience as well, issues related to data exchange. Maybe there are some traditional quality improvement methodologies that we need to involve, or at least to guide our users to go through those quality improvement methodologies. Again, I also already mentioned the data protection standards, quality assurance, and data transfer framework in a systematic way throughout the project. So also really important aspect. Evaluation framework. Again, it's in gray because I kind of have a feeling that maybe this should be part of the scale-up model, not part of this toolbox. And then, of course, we need to identify examples and links to evidence-based best practices, and all other tools that could actually improve the quality of our solution. And it was also discussed that the elements that should be included to the toolkits are the self-assessment scale. So actually companies can use the tool and evaluate or do the self-assessment process. Then we should include for sure supporting engines like twinning opportunities as a list of support measures, also reference sites. Any other initiatives like EIT health hubs or any other support measures for innovative solutions to scale up, and also to scale up in other countries to go cross-border. And also it's really important to underline this importance of testing out new technical solutions in a secure network, and also to make clinical tests and evaluation. So this was really clearly presented during our those previous presentations as well. And collecting feedback. Well, this is in really small letters, but anyway. Now we have launched the process of toolkit design, and we are waiting for your feedback until 19th of October. So every single person who is watching right now this workshop, or we will also disseminate this information through our social media channels if they function, and then we can actually combine all the relevant topics to this one toolkit. And you can also see the link to the survey, but as I said, you can also find the link on our web page. So this is about collecting feedback, and the process still continues. And we have a few more workshops planned for the toolkit design, and also we hope to publish the toolkit in November this year. But let's see, it's quite optimistic. Then we would like to test this toolkit, and actually, yes, to have our companies like TempID or Cognos and other companies to test this toolkit, and we are ready to take the feedback also from them, even if it's negative or constructive, because then we are stronger in the future. And the really final design of the toolkit will be presented the next year. And it will be input to our scale-up model. So this is the process and next steps for the next 6 months. But now I would like to invite back Rait and Andres to have a really short reflection or feedback. What do you think about it? And really first expressions, what we should do differently. And as I said, we are ready to take this constructive feedback. Once you ask the question, you should be able to listen to the answers as well. So question to both of you, what is the main thing for you as a company, as a developer, as an industry representative, how to how to find out who is your main target group, or to whom you should include to this process first, and when?
Well, in terms of SpeakDX, well, our target group itself is sort of self-evident. So it's people with speech problems, impediments, either from developmental or some type of disease effect reasons. Obviously we, as a company building a platform with various kind of modules or features, we, in order to capture as many people in need, we have to focus first on the diagnoses or problems that are more prevalent, that basically sort of outlines on how we define our target groups. So one is also, of course, who is the target group in terms of the user. Mm-hmm. In our case, and I also got 3 questions to us. One is pertaining to that topic. In our case, the user is not always the buyer or the payer. In some cases they are, if they're home users. But for instance, the question we got was that, does your pilot have financial feasibility? Can it survive as a self-finance subscription-based model? Or does it have to be state-sponsored, seeing as only 1% of the population will be using it? So 1% was actually the number that only covers the stuttering population. For instance, in children, the official number, the statistics show 9% of children have a speech problem. The reality is much worse. So on the ground data for us shows that it's every 4th child in kindergartens that is struggling with some type of speech problems. And because of that, the platform is financially feasible already. In Estonia, it's either the schools or the kindergartens or the hospitals paying directly based on the number of specialists, and then the user accounts can be included if they pay more. But we also have an excellent relationship with the municipalities, who are actually the ones responsible for providing speech therapy services to these institutions. So in our case, it's, at least in the Estonian context, it's already working well. And maybe I'll just quickly answer a couple of other questions as well, that how many languages is the platform available in, and how flexible is the platform to use in other languages. So the second question, we built it from the scratch to be language independent. So that's why we created templates so that you can adjust it to any language. We have already localized the platform for Lithuanian language, Russian language, and Spanish. We're also working on the Georgian, Latvian, and Polish versions. So yeah, so that's to answer both of these, three of these questions.
So yeah, but right question to you, obviously also target group, people with who I need to measure their body temperature. But if you think about the implementation of your solution, who are the stakeholders and how you did this mapping around your end user? Who are the significant stakeholders you should involve also in your design process?
It's been tricky, I would say, because in our product or service, there are so many different groups. Different age groups, the different sickness groups, the organization groups, is it the hospital or home users and so on. So just regular process, I would say. We used first the brainstorm to collect all the possible groups. Then we rated them or put them into the Pareto diagram. What is the most important for our product? And then, of course, if you go to the end user trials or data collection, then we must think about also three more aspects. One is that if we use only one end user group, can we use this data to make the product officially validated? So at some cases, there is a demand that different groups are involved, since we don't know who will be the end user. If they're buying the product or service, maybe some other group is using this, then we don't have the validated documentation for this group. So that was the number one, how we chose the end user groups. Then the second one is, of course, what will be the possible product coverage within this group? So how big will be our product? So if we choose only, I don't know, 4 years old kids, if we add also elderly care or something, how big will be our coverage? That was the second point. And of course, the possibility to do the trials is also, some cases, it's very, very hard to officially find that kind of groups that we need. Like I said, some special diseases or special health conditions, it's very, very hard to find that kind of groups to do the trials. So we must also consider about this, what is possible to get from the groups. That's the third one.
Actually, right, there is a question to you as well, like Finland, Spain, Kenya, how and why did you choose these countries?
Again, that's what became available. I would say like this: we didn't chose those countries, but those opportunities got available for us. So that was the reason, and also the numbers were rather big. Of course, Estonia is. We chose this because it's our home country, and it's a little bit easier here to organize all the clinical documentation and so on. So that's why this. But yes, simple answer is because those opportunities got available for us. So that's why.
And of course, Finland and Spain are part of this innovation for active healthy aging network. So it's also part of the project. So that's why maybe. Now I have a question, like really practical question. You partly answered this, and what are the more used formats that you actually use in your everyday? Is it like brainstorming, or you, Andres, perhaps you will think in your head that this is the way to go, and then you just tell your team that this is how we do, or you have brainstorming or any other formats of discussions?
I mean, we have I think an extremely flat structure, and I think most of the sort of I don't know, it's job profile or for us is, analytics from one angle or another. and then generating sort of the process and the activities based on that. So very strong internal analytics, some external input as well for that. And of course, in terms of the tools, whether it's issue management or drawing down the workflows in whatever tool, can be Figma or Draw.io or any type of tool. It's also we've used tools where you can simulate those workflows as well with different parameters. Those are a bit more complex. So those are so rather basic tools, I would say. Brainstorming for sure, like typical whiteboard, pen and paper. Just discussing like what the priorities are for the platform itself. So that drives a lot of some seemingly important or also expensive features and developments might be very nice to have, might be just nice to have, not critical to delivering the service or the product. So we're constantly prioritizing those lists.
Yeah, same question to you, right?
Yeah, in our case also, of course, brainstorming, but quite often the brainstorming ends up that you are alone in a hotel and doing alone the brainstorming. Basically, because it's so quickly you need to give some answers very often. So you cannot gather the entire team and do the official way of brainstorming, but you just write down all the different ideas and just ask the acceptance from the rest of the team. So that is the real life. Of course, we want to do it all together at some cases, but many cases it happens like this. So what else we are using in our products or trials? Quite often it's not only our product end user data collection that is inside this project. So we must modify our system or the environment we are using a little bit so that also other parties could collect the information they need through our system. So that's also one key element in our product, that we add something more to our system to help other parties also to collect the end user data. So it's for the different reasons. Many cases it doesn't make sense to do just only for your product the end user data collections, but you can actually add some more other products into the systems to collect the end user data and cooperate. I would say cooperate with the different medical, I would say not startups, but organizations, so that they can benefit also out from your trials. So in our case, it worked pretty well, and that's why those maybe seems random countries also, that the partners we have had and have right now, they wanted to have, especially in those countries, data collection. Basically, that was the reason. So cooperate, and that's how it goes, I would say.
Mm-hmm. Yeah, how important is to you as coming from the industry, are those all kind of different project tools and like this twinning project, for instance, or several testing opportunities that projects are offering, or collaboration with reference science, for instance, all sort of infrastructure that is built with the EU money, and also good practices available online. And how much do you use actually this kind of tools, or you go just you build your way and you follow your goal? And
I mean, for our so needs and purposes, so we've used so basically I think us and TempID, we have got similar support for some of these countries. I would also emphasize that if you're eventually trying to build product that is globally accepted, then it's completely fine validating it, using it, getting partners in seemingly random countries, because it validates, for instance, in our case, large countries have regularly large languages, smaller ones have small languages. That's an important factor for us. The availability or the capability to pay for the service. In our case, it's always adapted to the standard of living. So something that we charge 10 euros a month, for instance, in Estonia, might cost €1 a month in or $1 a month in Kenya, for instance. So that's but then Kenya has 50 times more people than Estonia. So in terms of the market potential, it might still be 5 times higher. Also with the very strong mobile penetration there. And we've also used other types of support. For instance, like the IT Health, the Piret program was for another product, but introducing basically us to the German and UK markets. And with the German market, it has already materialized very well. With the UK, it's still a process, a very active process where we have the NHS Innovation Agency as a partner, trying to find the right sites for us. But I would encourage especially startups that are bootstrapping to use these opportunities as much as possible, because yes, they come with their own bureaucracy and reporting and all those requirements, but at the same time they are non-dilutive, and you have like instant access to let's say user base or partners. So that's
right. How do you find these kind of sources?
One key element to finding those sources is, of course, this connected health. What comes to the health technology, networking, and everything like this. So this is connected health is organization from where we can get different connections that help us to do the next step. Our product, we also need to produce this somewhere, and of course, many cases where we are producing those, or whether to have it our own production, we use some EU foundation, and it's maybe it's not special for us, but those companies, we can see those EU signs and everywhere. So due to that, it has been also good opportunities for us. What I could add is the biggest risk in nowadays we can see is not used opportunities. That's a fact that is the biggest risk right now.
So now it's your turn, actually. If you look back the list of the questions or consideration that were on the slides, like really your instant first feedback, what is the most important for you to use this kind of toolbox, for instance?
Well, in our case, we have not used, I guess, that particular toolbox.
But you can't, because it's not existing yet. We're still doing it.
So what I would, obviously, I mean, what I would like to see in that type of a toolbox is, well, if we talk about our experiences, then, effective tools of getting meaningful instant feedback, sort of non-repetitive questions, I guess, from the target group. Also, the opportunity which we did not have an opportunity to change the surveys after each phase, so it remained the same. But let's say you have 20 questions, you will figure out after the first phase that some of them are irrelevant or redundant or something like that. So having an adaptive type of approach where for the second phase, you can already improve them kind of without killing the data from the first phase. So, I mean, that would be great to have in a toolbox where sort of co-creation and target group involvement happens. But then again, if it's an actual clinical trial, if you're going to go for, an actual medical device certification, then you cannot do that. So you have to have this data somehow consistent throughout. But this type of adaptive thing where then the product is improved based on that, just for the development purposes, and it's not a clinical trial, I think it would be perfect.
And right, you have more this clinical trial approach.
Yes, we have this clinical trial is a headache for us, but about this toolbox, right now I have some doubts that that kind of overall toolbox is possible to do, because all those medical products or services are quite special. So every each of those will use different methods or even the groups or the patients or whatever. So it's and of course the process flow is then also quite different. But we will help you to, at least for our cases, to build up that kind of toolbox. Then will be lots of 10x projects in the future.
Well, thank you. I do agree with you that the scope of this current list of topics that were listed, it should be more focused, of course, but I guess that there are some really part of the process that are the same for each and every company. And then we need to define what are the different paths or goals of the companies, and then what should be the questions of the toolbox and how to build it. But thank you for this discussion. And as I said to the audience, you're most welcome to put your comments, and you can find the link to this survey or this feedback form on our webpage, or just write an email and we will send you back the link. And let's move forward, and hopefully we'll have a toolbox that at least some of the companies can use.
Yes, for sure. Like I said, I have those doubts right now since we have seen so much special cases. But hopefully it is possible to at least give the pathways of different products or services what to follow.
Yeah.
So.
Thank you, Andres and Rait, and see you also in the future in our programs.
All right. Thank you very much.
Thank you.